Talking today about ACL rehabilitation and kind of the stages that you'll go through after you injure your ACL. So the ACL itself is a ligament that attaches your femur to your tibia, and its main goal is to limit the amount of forward translation of the tibia on the femur. And this is typically coupled with a little bit of rotation that happens. Most of the time with these ACL injuries, it's during something that would be very quick, mostly with deceleration, change of direction, or if you're coming down and you're landing on a leg. We only have so much time that we can react. But sometimes these things happen so quickly that our muscles around the knee can't react to assist that ACL. And when we get into these precarious positions, all of the load falls very quickly onto the ACL, and it just essentially reaches its limit, and that's when we see these ACLs rupturing. The first step is always the early stage rehab. You're just fresh out of surgery. Our main focus at that point is going to be working on range of motion, reducing the swelling that's around your knee, and then also working on some early activation exercises to get your muscles functioning again. After that, we go on to strengthening, where we can really focus on along the quadricep strengthening, hamstring strengthening, and a little bit of hip and core as well. So after we get done with the base strengthening, we'll continue to work on that for many months. If we're lucky enough to work with you into the later stages of rehab, this would look like running, jumping, change of direction, all the fun stuff to get you back into the higher levels of function, or to help you return to sport. So some of the things that I would recommend early on in this process, because this can be a very long-term recovery, is just preparing yourself in the best way possible. And it's going to be trying to stay as active as you can within the restrictions that you are allowed with. Sometimes that is continuing to exercise either through some low impact activities like riding a bike. At a certain point you might be able to get onto like a stair stepping machine. Eventually this will lead up into running. But things like that to where you can still remain active. You can get involved either if you're in a team sport. There's going to be phases of your rehab that you get to return back to your team and get into a group setting, whether it's in the weight room or with some non-contact drills. These are all things that should and can be addressed throughout your rehab with proper coaching involved. So one of the first things that you're going to be working on after an ACL injury is trying to get your knee straight and trying to get your quadriceps working to its highest potential. So this exercise is a little combination for both of those goals. It's fairly simple with the idea behind it, but it can be very hard after a knee injury. So what you're going to try to do is to tighten this muscle up. This is your quadriceps muscle, as hard as you can. And when you do that, it should feel like the back of your knee is going to touch the table or the bed, and your foot should just slightly lift off of the table. And you can hold that for about 5 seconds. This is going to be one that you're going to be working on constantly throughout the day. Eventually that quadriceps will come back fairly well. The other exercise that you can start doing fairly early on is what you call the heel slide, and this is just to work on flexing your knee. Easier just to get a strap or a towel that you can put around your foot, and then you're just going to use that strap to help pull your knee up until you feel a little bit of tension coming in your knee, and then let it go all the way straight again. Depending on if you do have a surgery for this type of injury, sometimes those come along with range of motion restrictions, so just make sure you check with your PT or your surgeon before you do that type of exercise to make sure that you are within your restrictions.